Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day this week, Monday through Friday at noon for this update number 45, coming to you live on Thursday, May 14, 2020. This forum is being brought to you live by PACTV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PACTV's streaming channel by going to pactv.org/live. For today's questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Dr. Phillip Triffletti. He's an attending physician at Beth Israel Deaconess. Also, Stephen Cole. He's the executive director for the Plymouth Regional Economic Development Foundation. Dr. Christopher Campbell. He is assistant superintendent of Plymouth Public Schools. Muriel Paul. She's the community engagement facilitator, Healing Communities Study at Boston Medical Center, and Julie Thompson. She's the executive director of PACTV, which is Plymouth Area Community Television. At this time, we're going to go directly to the chair of the Plymouth Board of Selectmen, Ken Tavares. Welcome, Ken.
Thank you, Steve. Good afternoon, everyone. It's going to be a special program with Julie front and center instead of being behind the camera. Welcome, Julie. We're looking forward to your presentation. I would like to remind the community on behalf of the Board of Selectmen that during the month of June, we make appointments and reappointments to various committees that the town has set up. So if you are interested in serving on a town committee, please go to plymouth.gov. There's a listing of where the vacancies are and what is available. We will do all the interviews in June and have everyone ready to assume responsibilities as of July 1. Today, I was able to sit in on a meeting with the Center for Active Living. It was their board of directors meeting. And I am so pleased to report, and we hear so much of it from Michelle Brady when she's on the camera here, that they are doing well. There are a lot of programs that are being taken advantage of, and it's really a salute to these folks for the wonderful job they're doing with the elderly in our community. Back to you, Steve.
Thank you, and that's Kenneth Tavares. He is chair of the Plymouth Board of Selectmen. Each day we begin our panel with a health segment, and each Thursday we've been joined by Dr. Phillip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Thanks, Stephen. Again, I appreciate the opportunity to speak to the community here about my perspective as a primary care physician. I wanted to start by just telling you about a patient that I saw, or actually was talking to on the phone via televisit just yesterday. He was a retired physician like myself, an internist, and he was getting short of breath for about a week, and he could only walk about 30 yards, which was really unusual for him. He could usually walk about 4 flights on the stairs. And he was calling me because he said, I wonder if I need a COVID test. But after I began speaking with him, he has a lot of other medical problems on dialysis and things like that. It turned out that, the best place I felt for him was to go into the hospital. And of course, unfortunately, he did have some serious medical issues which required him to stay in the hospital. The reason I talk about that is that we are still seeing that people are delaying care. And in non-pandemic times, that's always an issue still, that some people delay calling their doctor when they're sick. But it does appear during the pandemic that we're seeing still very low utilization of the emergency room. We've seen about a 1/3 reduction in heart attacks coming from the community, which makes a lot of experts think that people are having the heart attacks at home, which we, of course, don't feel is the best place or the safest place to be. So I would encourage people still to, don't hesitate to contact your doctor if you're having new symptoms of concern, because we do still feel like this is an issue out in the community. I'm trying to resist temptation. A lot of my patients want to see me face to face. And while I think the interaction might have a somewhat higher quality, and certainly some extra things we can do when we see each other face to face. I think there still are risks, while we're in the midst of this pandemic. So, it's been hard for me to tell patients, I think it's better if we just do this over the phone. But most of the patients understand. I've had some patients who are in need of mental health services, for instance, and need a therapist, and I've referred them to licensed social workers, and some of them reluctant to start up a new relationship via a virtual or telehealth type platform. But I'm encouraging them to do that. The therapists feel like they can make great connections still with their patients, even though they're doing it virtually. So that's another thing to keep in mind. That be very open-minded about trying to use these new tools, even though it's not maybe what we're accustomed to. I think there's a lot of interest right now, thinking ahead in the next few weeks and months, how much society will be opening up here in Massachusetts. We've been delaying in the medical field a lot of elective procedures and preventive care, elective surgeries. We'll be getting, of course, more guidance from the governor and his task force next week. I think there are a lot of things we can do safely for our primary care patients. I think it's easy to draw blood. It's easy to do things like mammograms, immunizations. There's been a lot of data showing how much the pediatric immunizations have declined, and we're not really sure what the impact of that might be on people's overall health, as well as missing out on a lot of other screening tests. We know breast cancer diagnoses have dropped dramatically, and that's because we're not doing mammograms and doing biopsies as regularly. So I think there's still a lot to be learned, but I would ask people to be open-minded as we sort of ease back into a social reopening, that some of the things I think we can do extremely safely, and we'll need to continue to do those things. I thought it would be nice to take a few minutes to talk about some of the challenges of testing. And I think the best example we have of this is problems they've had at the White House, where some of the staffers there have gotten infected. I think it goes to show how sneaky the virus is. I like to call it the sneaky virus, because you can't always detect it early in the phase of infection. And as we know, people could be asymptomatic, no fever, no symptoms. And the other complication really is that some of the testing, and if you were watching CNN last night, you would have seen them talking about a study at NYU with the Abbott analyzer, a rapid turnaround time, like 15 minutes or so, that they were seeing, they were missing as many as like 50% of the positive tests. I think that we do know that some of the rapid analyzers may miss up to 15%. So that's some of the technology they're using at the White House, for instance, so that they could be surrounded by people who actually are infected. They did a nasal swab, it came back negative, but they actually were infected. So, there's all kinds of pitfalls that we could run into. I just think it goes to show we can't 100% protect ourselves, live in a bubble, but there are many things we can do, like the social distancing and the hand hygiene and all the other things we're doing to reduce the risk of infection. And even in the best of circumstances, some people might still, break through our safety nets. So that's just something to keep in mind. I think I've used up 5 minutes, so I'm going to end there, and I'll be ready for questions at the end. Thank you very much.
Thank you, and that's Dr. Phillip Triffletti. He is a primary care physician attending at Beth Israel Deaconess Hospital. And at this time, we welcome back Dr. Christopher Campbell. He is an assistant superintendent of the Plymouth Public Schools. Welcome, Chris.
Thank you. Thanks again for having me again, Steve. I'd like to take an opportunity today to share with the community what the Plymouth Public Schools is doing as we prepare for the fall. Our families and communities need our schools to be ready to open, as soon as the public health officials signal that it's safe. And I think we all have been reminded these last few months just how vital our schools really are to our students and to our families. We need to do everything in our power to reopen our schools in a manner that's safe and responsive to the needs of our families, our staff, and our community. And we realize this is going to involve novel challenges ahead. So we have begun planning the initial phases, realizing that we need to start our planning before any official guidance is formally issued. We've just started to brainstorm a roadmap that will serve as our framework for this planning process. And this framework will take into considerations the best practices from the CDC, as well as other sources regarding prevention, mitigation, response, and recovery. And while we understand that direction will be forthcoming from the state and public health officials before we do anything, we need to begin our planning now to ensure that our staff and our families feel comfortable with the measures that we eventually put in place to alleviate and address any potential concerns that may exist. So we will be initiating the formation of a reentry advisory committee, and this committee will be charged with making considerations for a return to school. So through the work of this committee, the district will be considering a number of recovery areas, such as our general governance and school operations. We'll be considering the physical and emotional health of students and staff, as well as our academic programming and instruction. We're going to need to complete a thorough assessment of our physical instructional environment to determine what measures we need to take before schools open in the fall. With extracurricular activities and sports being such a large part of our school communities, we'll need to prepare and respond to the guidance of the governor and local health officials in that regard as well. We also need to review any policies that need to be reconsidered, such as our attendance policies and school visitors policies as we open in the fall. Food service distribution, packaging may need to be reconsidered as part of our reentry plan as well. Transportation, as you all know, we're 104 square miles, and transportation is a significant resource to our students and families here. We may need to reconsider how our buses currently operate as well. One thing we've recognized during this pandemic is the disparity in technology that exists among our households. In the last 2 months, for example, we've distributed nearly 1,000 Chromebooks to students during the closure. So technology considerations will need to be thought through thoroughly as we plan for any potential phased reentry and any short-term closures should our community experience a reemergence of these COVID-19 symptoms in the fall or in the winter next year. So as we reflect on the governor's recent announcement for the state's 4-phase approach to reopening the economy, we too understand as a school district that we may need to prepare for a phasing of our own educational system. We may be forced to consider a progression of reentry through phases ourselves, where we first limit the number of students present in the school building, eventually return to full capacity. So we really don't know, but we need to prepare for that regardless. We may be asked to limit the number of activities each day to allow for continued social distancing. Regardless of the potential phases and the guidance that we receive, we understand that we must continue to plan for mitigating factors that may arise also. So at all phases of our planning, we also know that we'll need to monitor for any reemergence of COVID-19 symptoms, as I said a minute ago. So this planning is going to take us some time, Steve. It will be very significant and time-consuming in nature. Throughout the process, it's very important that we gain diverse perspectives on everything that I've already mentioned, plus more. So our advisory committee will be significant in size. We want to make sure that we have representation from every school. It's critical that our unions are involved throughout the planning phases as we consider the working conditions of our employees. And our parents and family involvement is also essential, as well as the support and the input from our school committee, of course. So as I already said, while we don't have any specific guidance yet, it is important that we brainstorm every possible scenario and take into consideration everything we can so that when the guidance does follow, we are best prepared to put our plans in place and communicate them to the school community and reopen our schools safely. So we look forward to this work, and we realize it's going to be a challenge, but it's important that we start now.
And that's Dr. Christopher Campbell. He is the Assistant Superintendent for Plymouth Public Schools. You can send him and our panel your questions to plymouthinfo@pactv.org. At this time, we welcome a new guest to our panel and our forum. It is Muriel Paul. Muriel Paul is with the Community Engagement Facilitator Healing Community Study. Welcome, Muriel.
Hi, welcome. Thanks so much for having me here today. Thanks to Rep Muratore for the invitation. Came through Sour Cloud. I'm excited to be here. So I'll tell you a little bit about me and kind of how I, and why a Boston Medical Center employee is here on your PACTV, newscast today. I recently took this job with Boston Medical Center to facilitate the Plymouth Heal Coalition. Prior to that role, I worked in the Plymouth community, co-coordinating the Plymouth Youth Development Collaborative, worked closely with Dr. Campbell as well as Rep. Muratore, and a host of all other amazing stakeholders in Plymouth with the goal of reducing the impact of youth substance use. Back in January, though, representatives from Boston Medical Center got in touch with a lot of members of PYDC to let us know that Plymouth had been selected as a community to participate in the Healing Communities study. And what that study is a funding source that it's a research study that came from the National Institute of Drug Abuse from the federal government. And the goal of the whole study is to save lives in regards to opioid overdose. So in the next we're in, by the end of 2021 and rolling over into 2022 in some communities, we want to reduce opioid overdose deaths by 40%. We know that that is a large undertaking. We know that the opioid epidemic has ravaged our country, our state, our communities. So Plymouth is unique in getting the opportunity to participate in this study. One of the kind of pieces of it, and when Boston Medical Center came to the community of Plymouth, the stakeholders kind of around the table looked at them and said, we're doing a lot to address opioid overdoses, and we have been doing a lot for a long time. But when they, applied for this opportunity and this research study, it was looking at data from 2016. And so recognizing that communities all over Massachusetts were losing valuable, members to substance use disorders and to opioid overdoses, and recognizing that there were ways and so much research has been done for ways to treat substance use disorder, but still we were losing so many community members. So Plymouth is one of 16 communities that's participating, and the goal is to build a coalition of the stakeholders who are already doing this amazing work in Plymouth. So anybody who has a hand in saving lives, from criminal justice settings to the medical field to prevention specialists to overdose education trainers to outreach workers to people who work with the highest risk populations, including people who struggle with homelessness, including people who are have co-occurring disorders and mental health issues, people who have physical health issues as well. The goal of the study is to reach populations that aren't traditionally being reached or isn't happening yet. But the good thing is that my role, my experience of working in Plymouth, and now my experience of working with Boston Medical Center, my role is to act as a liaison between the two places and to really build up and enhance the programming that's already happening. So the coalition's been meeting since January, but we're still looking to add additional members onto the coalition who can help us to guide what the strategies might be. So the kind of process of the study is to bring these people to the table, anybody, who has a stake in this, to, look at what the existing services are already and kind of take a lens at seeing where there might be areas of opportunity to meet people who haven't kind of crossed the system yet. So I don't know how aware people are with the Plymouth County Outreach Program, but that was started a few years back, and it's a law enforcement-based program that collaborates with recovery coaches. Chief Boterri here in Plymouth was a leader in starting that program, and we are, really looking to them to help us, find areas where where there's more opportunity to get services out to people with opioid use disorder who need them. I think that, in light of COVID, of course, the overdose epidemic has been happening for a long time. And in light of COVID, I started this new job at the beginning of April. So just to give you some context of starting a brand new gig in light of all that was happening in the world, like my thoughts were, how was this going to happen? And really the day I started, it was people who are at highest risk of opioid overdoses are at even higher risk in the midst of COVID. So our work is that much more important to bring stakeholders to the table and figure out how quickly we can get more resources into the communities and into the hands of people who need them. So some of the specific strategies of the grant is that the coalition will look at these areas of opportunity, and then the coalition, the members themselves, have the opportunity to choose which evidence-based practices they would like to implement, and then choose how exactly they'd like to implement based off the skills of the people who are already around the table, based off the capacity, and using funding from the Healing Communities study, as well as training and technical assistance from all of the many people on the Boston Medical Center side and on the state side who are available to help with some technical assistance and training needs. I think that, the biggest piece of this is that we are looking towards working with people within the community who are already doing this work, and really having it be a community engaged process. That's what we're most excited about, and that's what I'm most excited about. Having had relationships with so many people within the Plymouth community who are already doing great work, and now bringing everybody to the table and seeing where else we need services, especially comparatively to other communities who are experiencing the same issue around opioid overdose. Another piece of the study that I haven't touched upon yet is that there's a communications campaign. The first one was just launched, and it's all around accessing Narcan. It was ready to be launched, and things had to be tweaked a little bit in light of COVID, since we're in this digital age. And so there's three other states that are participating in the study as well: Kentucky, Ohio, and New York. And so this is a national campaign that people in Plymouth have tweaked to create messages that will speak directly to the Plymouth population. And so right now, the one that we're rolling out is all around access to naloxone, or Narcan, which is an opiate overdose reversal antidote that any person can get at a pharmacy right now without a prescription through the standing order in Massachusetts. So that's what we're really trying to encourage people with substance use disorders, as well as their loved ones and their families, to make sure they have access to this medication, especially when so many people are, within their house, and we want to, be cognizant of all that the medical community and first responders are dealing with. It's important to call 911 anyways, if an opioid overdose was to occur, but having naloxone on hand, the difference of response times in seconds is how we can save people who are struggling. I think that about covers it. Some of the other kind of just more specific pieces, I don't know if I touched on. So it's this increase of naloxone or Narcan within the community. It's also an increase in connecting people to resources that offer medications for opioid use disorder. So really getting people connected to treatment, finding out why people aren't accessing treatment in the first place, and engaging them and retaining them in a treatment that works well for them. And then the last piece of the study is looking at all of the great work that's been done around safe prescribing and dispensing practices in Massachusetts. A lot of guidelines have been released over the years, but really making sure that providers in Plymouth have access to the trainings that they need to prescribe safely, that residents have access to where there's information to dispose of medications safely, and really just enhancing so many of the services that are already available, and making sure people know about them.
Muriel Paul, and she is with the Community Engagement Facilitator Healing Community Study. She'll be here to answer your questions. PlymouthInfo@PACTV.org. And at this time, we welcome back Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation, and he'll be providing our business update. Welcome, Steve.
Hi, Steve. Thanks for having me again. It's a sunny Thursday. I hope folks are at home watching us right now, but afterwards are able to get out and enjoy some of the weather safely with some loved ones. I want to share with some of the viewers at home today some polls that are coming out. It's forecasting some fairly positive news, or at least some opportunity for positivity. There is also some concern, of course. And of course, as always, when I come, I try to give folks at least a pithy statement about what all of this really means. And frankly, I just want to tell folks, what gets measured gets done. And in the spirit of the census season, I do want to make some folks aware of some polls that are coming out, some from myriad sources. Economics, as we've talked about before, is a statement of behavior. How we spend our money and our time is a statement about the things we care about and support and sometimes need to have. So as it were, data is, sometimes a way to bring some control or some understanding to chaos. And as we all know too, economic data has all but stopped. So right now we're relying on polls, and we've been under this shroud of uncertainty long enough that, a lot of data is starting to come in. I think a lot of us have a common psychological mindset also that's being captured. And one of the more exciting polls I came across this morning while doing some research was the Morning Consult political poll. This was an open-ended answers. There were no prompts or limits on what respondents could write. Excuse me. And what we're seeing out of that poll, this is a nationwide study, 22% of Americans report that they want to get out and see friends and family again. 19% are reporting that they're excited to go dining out. 8% are reporting that they are excited to go shopping. 6% are talking about vacations. Another 6% are talking about great outdoors. Only 2% are talking about going to the movies. I don't think there's any shock there, considering I think every one of us has seen everything that has possibly been produced at this point on Netflix, Hulu, Amazon Prime, and some of the ancillary ones. There's another number, though, 14%, who said they'll do nothing when recovery happens or when reopening happens. As of yesterday, 26 states and DC are under stay-at-home orders. 15 of those states have begun easing back on some of those social distancing measures. So these polls give us a pretty good insight to what we can expect when the Commonwealth starts to open up again. But I want to focus on at least 5 of those numbers that I threw out, because to me, it gives us an opportunity here in Plymouth. What are we known for? Well, we're known for our great restaurants. We're known as a place where people come for vacations. We're known for our vast open resources and conservation space. So again, I just want to reiterate, 19% of Americans report that they're excited to go dining out. 8% on top of that are looking at shopping. 12% are looking at vacations and great outdoors. When you break those down into those unique responses that people gave, they talked about things like going on long road trips to see the country. They're talking about going on tourism destinations locally that they have never visited. And I think that there's some really good insight there too, that no one is talking about traveling abroad, which means we have much more of an opportunity to capture our own domestic population for folks to come to Plymouth. And I'd say this too, 14% who talk about doing nothing, there's an opportunity there too, because if we can show them that Plymouth is opening up right, that we're following the instructions from our healthcare professionals and our state leaders at the governor's office particularly. I think, Matt, we're expecting Monday some more feedback from the opening task force. So we'll have a better insight at that point to what we can do to help position ourselves so that when we do reopen, a full 39% of respondents are ready to get out of their homes and they're looking for a place to go. Let's give them that place, but we can only do it if we're willing to follow the instructions and do the right thing ourselves as small businesses and as residents. And I'll tell you, add 14% of that, I think we can convince them that Plymouth is a place worth visiting when all of this nonsense goes away. So that puts us at 53% of the country that we can convince, perhaps, to come to Plymouth at some point when all of this nonsense has dissipated. Something else that's coming out of this, I want to remind folks, a Twitter poll reported that 60% of Americans say that they will work at home when all of this is dissipated and return to work orders are issued. 60% will stay at home. They're eager to get out of their home, but they're not necessarily eager to get back into any kind of a commercial office setting. There are some impacts, I think, that we can expect from this. Namely, travel and transportation policy will likely change. If 60% of the labor force is able to work from home, we're not going to see the kind of congestion we saw before. We're not going to see the same demands on the infrastructure, which means I think that we all know that, governments survive through tax revenues. And how do we get taxes? Well, we all pay, right? Well, there'll be fewer businesses, I think, after this until we can get ramped up through entrepreneurship and small business development. I think that although the state is going to see a bit of an impact and localities will see a bit of an impact to tax revenues, obligations will actually be lessened as a result of this, partly because we'll see fewer people putting stress on the infrastructure. What's more, I'd say that commercial leases will certainly be impacted. On the negative, we'll probably see some businesses downsizing or right-sizing given the new climate or circumstances. But look, I have to remind folks, Plymouth is not an environment that has a robust built climate. There's not a lot of buildings that new businesses can move into right I do expect, I've talked a lot about this on past broadcasts, I do expect that we will see an increase in entrepreneurial activity. New types of businesses will no doubt come out of this. People who are sitting at home, I've been challenging you to give some thought to the type of a business you would like to run if given that opportunity. Businesses operating today should give some mindfulness to what their business plan should probably look like in the aftermath. The regulations that we're going to see on Monday will give us better insight to what your business plan could or should look like. And these polls are giving us better insight too to who your customer base could potentially be and where they might be coming from. So in places like Plymouth, where we have, limited built environment, this could cause some companies to downsize, as I said, but I think it creates an awful lot of other opportunities. And before I get into questions and answers at the latter half of the segment, I'd be remiss if I didn't mention that the Plymouth Economic Recovery Task Force, which is being headed by Amy Naples at the Plymouth Chamber, they have put together 2 polls, one for businesses, another for residents. Please participate, because as I said, what gets measured gets done. If you have concerns or if you have insights, please make us aware of those by participating in those polls. You can visit the Chamber's Facebook page or their website. Those polls should be up soon if they're not already. And why this matters is because of these polls that we're seeing, 44% of Americans reported that their day-to-day life has actually gotten worse amid this pandemic. 33% said that their day-to-day mental health has actually become adversely impacted. So this actually has a huge economic impact if we don't address these things now, because these are folks who won't necessarily be healthy enough to re-enter the workforce or to re-enter the marketplace or to re-enter, any kind of entrepreneurial activity. We have to pay attention to our neighbors. We have to address these things head on early. And so I'll thank everyone who's watching at home to participate in this poll. Thank you, Steve.
Thank you. Stephen Cole is the Executive Director for the Plymouth Regional Economic Development Foundation. This is update number 45, and each day we talk about our core group, Ken Tavares, Matt Muratore, and I bringing this to you. But there's a 4th person that has been with us every day for all 45 updates. She's normally behind the camera. Today she's in front of the camera, and we're delighted to welcome Julie Thompson. She's the Executive Director for Plymouth Community and Plymouth Community Area Television. And Julie, what can you tell us about how television and the media has had to respond to the coronavirus?
Thank you, Steve. It's really weird not being with you today. I'm so used to being socially distanced next to you, but thank you for having me. PACTV is the local community access TV station for the towns of Plymouth, Kingston, Duxbury, and Pembroke. Our mission is to inform and empower communities to connect and engage through media. And that's what we've been able to continue to do throughout this entire pandemic. For our towns and municipalities, we've adapted to covering their meetings remotely via the Zoom platform and maintain televising them on our local channels, allowing the public to view and participate in different ways, abiding by the tenets of open meeting laws. We've hosted forums like this one that you have coordinated, and ones for our other towns, which have offered timely and productive information for the residents, businesses, and organizations throughout the community. Our state representatives have coordinated some forums around subjects such as mental health and well-being, small business and finance, legal aid, etc. We will continue to pivot and adjust the subject matter as new guidance becomes available. Some of our community producers, those people who create their own shows here, are either taking a hiatus and having us replay their shows again, or creating content at home and sharing it with us to air on our channels. We've added several new religious services and masses from local churches who see the value of sharing content for their parishioners via community access television until they can meet and worship together again. The local scene, which is our flagship community outreach vehicle, is in high gear. Local Matters, our feel-good show, continues production, featuring the resources and good news happening in our area. Our robust outreach efforts support the local libraries, the Council on Aging, nonprofits, schools, artists, musicians, and community members in telling the stories they want people to hear and relaying information that is important for people to hear now. Since field interviews are verboten because of social distancing, we've been conducting interviews via Zoom and supplementing our stories with videos submitted by the community. which has been a serendipitously positive evolution of the show. As planned previously, Local Matters went from bi-weekly to March 20th, went to weekly, and it airs Fridays at 8 on the community channel. It can also be found on Facebook, Instagram, and our YouTube channels. We continue to produce PSAs, or public service announcements, for nonprofits, now remotely by collecting their photos, their logo, their script through Dropbox, recording the voiceover here in the studio, and editing in the graphics. We also create monthly newsletters for each of our towns, which highlights the variety of programming and services that we've covered for the town. It contains links to many of our videos. As far as covering the happenings at our local schools, well, clearly that's been curtailed, but we know that this is a very difficult time, especially for seniors who are trying to graduate and keep a sense of normalcy. We commend the schools and the superintendents for doing their job on keeping the students safe and educated, but also keeping their feelings in mind. More information regarding graduation will be coming up as we approach the original dates that each school had set. And we'll do our due diligence to update the public as best we can. PACTV, like all community media centers really, is funded from a very small percentage of cable television revenues. The more folks that cut the cord and seek alternative platforms for their content delivery, the less funding centers like PACTV will receive. Knowing that that was the future we faced 4 years ago, we developed our Creative Media Services Department, which is our fundraising arm of PACTV. Creative Media Services, or CMS, is a seasoned collective of visual artists, technicians, and storytellers. We strive to be a partner in creating video content to meet needs for our clients' audience, from social media campaigns to training videos, podcasts to event coverage. We can help tell their story. When it's safe to resume, this department can also provide studio and edit suite and wired conference room rentals. During this strange time, this department has continued to produce. For example, we created a COVID messaging video for the Division of Marine Fisheries, which actually you showed on your show a couple weeks ago, Steve, about what they're doing to support the fishing industry and how residents continue to support commercial fishing during this. We have a client called Casimir, and they're doing drug trials. We're continuing to create videos and international translations of videos to show participants how to use video capture to collect data that's actually being used in human clinical drug trials for rare diseases. It's absolutely fascinating. The DPPC, which is the Disabled Persons Protective Commission, we've created a statewide training video about their sexual assault response unit and peer support leaders who support people with disabilities who have been sexually assaulted. For the Plymouth 400, which we proudly support as a media partner, we have been supporting them in curating videos received in their Illuminate Now campaign to shine a light on good works, give thanks, and give back. We created a video just yesterday with Michelle Pecoraro from the Plymouth 400 for use in this weekend's virtual commemoration coming from Leiden in the Netherlands, which was the Pilgrims' first stop when they fled the UK and prepared for their trip to the New World. We proudly partnered with the Plymouth Area Chamber of Commerce and Masks for Meds to produce and air, both on cable, YouTube, and Facebook, Coachella, which was a musical fundraiser that was wildly successful in raising money for Plymouth's One Fund. And finally, production is ongoing on our own documentary about these times, which will highlight our experience in response to life in extremis through the lens of the community and PACTV. We've been recording footage of all of our towns and behind the scenes, all of our forums and productions here at the studio as the pandemic has affected life in our area. There's no end to this story yet, but when there is, we will hopefully have painted it in an illustrative picture of this experience for posterity. We have an amazing, talented, and highly dedicated staff who has adjusted in the most creative and meaningful way to the realities of today. Whether in the studio or working remotely, we are a strong and flexible team who is here to serve our mission, you, the people. Thank you, Steve.
Thank you, Julie Thompson. She'll be with us for our questions. She is again with PACTV. And at this time, we're going to go to Plymouth State Representative Matthew Muratore. Matt, that's a hard act to follow.
Yeah, it all is. I don't know if you have much time for me today. Everyone's so chatty today. But it was great information from everyone, of course, as usual. Full disclosure, I'm a board member of PACTV and so proud to be a board member there. And Julie and the team do a fantastic job. And, there's never a time where they say no. I've never heard them say no, never. I remember 9 years ago when we had the disaster in Shishigahama, and a couple of us were talking and said, how about doing a telethon? And there was no hesitation. It was just, yeah, let's do it. And we raised over $100,000 for that. So they're a fantastic group, and so proud to be a part of it. Thank you, Julie, for what you do. I always learn something from everyone every day, and I picked the word of the day out with Pippi. So I actually looked up what Pippi meant, Steve. So thank you for providing those words for us and those words of wisdom. We appreciate that. Let me quickly go through some numbers today. The governor is speaking now, so I'm getting feedback of the meeting as it's happening. So let me just quickly go through some of the numbers. First of all, the testing is up to 410,000. Another 8,500 were tested from the day before. That's 6% of the population have been tested. With regard to testing, the governor is talking about now getting tests up to 45,000 per day by July and 75,000 per day by December. And along those lines, there have been 10 new CVS drive-through test sites that have been approved in the Commonwealth. The one closest to us will be Carver. So more details will be coming out on that. But again, not everyone can go to get tested. You have to have a doctor's note in order to do that. But at least there'll be another drive-through testing site in Carver, which is near to us. And with regard to the number of confirmed cases, we have over 80,497, which is 19.6% of those tested have tested positive. With regard to the day before, another 1,165, which is 13.7%. And to put that in perspective, of those tested was 13.7%. And to put that in perspective, on April 24th, 26.4% of those tested on April 24th tested positive. So now we're down the low teens right now. So we're still getting there. We're still not out of the woods yet, but we're getting there. With regard to the number of deaths, another 174 from the day before. That brings the total to 5,315, with, again, 98.4% of these folks having underlying conditions, and 61% of the deaths are coming from long-term care facilities, skilled nursing facilities, assisted livings, or rest homes. Somebody asked yesterday, Steve, on the show about is there a way to start tracking the number of people who are out of the woods from that have been tested positive and that are better. Right now, as of yesterday, 27,812 have completed the quarantine period out of the 80,000 that have been tested. Now, there's probably more that have, but we know at least those 27,812 have. There's probably another 50,000 more that are either in the process of the quarantine or have completed it. But again, when you're self-quarantining or at home, you're not really going to a doctor's office to tell them you're all better. So that kind of gives us a little bit of an idea. With regard to Plymouth County went up by another 85 cases since the day before to 6,592. And the total number of deaths increased by 15 in Plymouth County to 424. The town of Plymouth has 369 confirmed cases with 23 deaths. With regard to hospitals, again, we're still at 4% hospitalization of those infected with the COVID-19. Although the ICU beds in the Commonwealth have, the number in ICU beds have gone down by 24 beds since yesterday to 794. The capacity of open beds in hospitals is in Southern Mass, our area is 47%. So there 47% of all hospital beds are open. 12% in ICU are open, and very similar numbers to in the entire state, 53% of open beds with 13% open ICU beds in the Commonwealth, which means, again, if you have issues, if you're having medical issues, don't hesitate to contact your PCP, or if you have to go to the hospital, call 911. It's okay to go to the hospital and get treated. You really need to. You don't want to delay treatments. At BID Plymouth, there are 65 confirmed cases or suspected cases of COVID-19 at the hospital. As of today, with 6 in the ICU. And Social Hospital has 86 confirmed or suspected cases with 17 in the ICU. The long-term care facilities, the daily testing is almost completed. There are 684 facilities in the Commonwealth. 663 have been tested to date. By the end of next week, all facilities in the Commonwealth will be tested. Right now, there's been 41,028 tests. Of those, 17,000 have been tested positive, with at least one in 338 homes. And again, the death toll is at 3,236 in long-term care facilities, which again is 61% of the population of folks who have passed away in long-term care facilities. Some of the other items that came up from the governor has to do with jobs available in long-term care facilities. Long-term care facilities are in desperate need of nurses and certified nursing assistants. So if you fall in this category and you can help it and work at these places, get paid for them, feel free to go to a facility near you or go to the mass.gov COVID-19 website and you can fill out applications and try to get jobs to help out these places. Again, the Red Cross is urging folks that to give platelets or blood to please do so. Contact them. With regard to the contact tracing that started April 12th, again, this is very important. As well as testing, contact tracing is also important for us to open up the economy and open up in a healthy way. To date, there have been 18,000 of the 80,000 people that have been contacted so far. And of those, another 14,000 who actually were in contact with these people have been called as well. They're still trying to get the word out, though, to please pick up your phone. If you have been confirmed with the COVID-19, definitely pick up your phone. And even if not, you may have not realized you got in contact with somebody that has it. Please pick up your phone. It will say on your phone, MA COVID team. And it will come from an 833 extension or an 855, area code, or an 833 area code, or 857. Please pick up the phone. There's a number of questions that they're gonna ask you, but this tracing is so critical to the health of our economy as we move forward. They will not ask you for any other information that is either your social security number or credit card numbers, anything like that. You will not have any of those questions asked. So please follow through and do that. And finally, domestic violence is obviously on the rise during this, courts aren't open, et cetera. So really, we're trying to get the word out that if you're experiencing in any sort of domestic violence, there is a 24/7 number, which is 877-785-2020 to call 24/7. There's Spanish as well as English. Again, 877-785-2020. And the one final thing, the governor is obviously asking people to wear masks when in public. Again, you may not realize you have it. And I still talk to people that amazes me that they think, well, I'm fine. I don't need to wear a mask. It's not about you. It's about saving somebody else. Again, you may not realize you have it. So that's why you need to wear it in public. Again, I keep reiterating on these shows every time we talk about this is somehow these 61% of these seniors that have passed away in our long-term care facilities, they got it somehow. It's not them going out. They're sheltered in place and have been. So they're getting it from people from the outside, whether people realize or not, passing it on to staff or whoever. So please keep that in mind. The mask is for other people's safety as well as your own. So please don't be selfish about that. And that's the update for today, Steve.
Thank you, Plymouth State Representative Matthew Muratore. We're going to go right to our question and answer. First question, Dr. Phillip Triffletti, an attending primary care physician at Beth Israel Deaconess. Dr. Phil, each day we try to bring to the community a blend of elected officials along with experts in health, education, and business. This past week, Dr. Fauci testified in Congress and made statements that were later questioned or comments were made from other elected officials. What should our viewers think in terms of your expertise, experience? What kind of guidance could you give us in terms of this disagreement in terms of the statements of Dr. Fauci and some of the other people in elective office?
Thanks, Stephen. I know this theme has come up before, trying to balance these things, certainly in the media and how it impacts our lives. I will say, of course, I'm not a politician, I'm not an economist, and I'm not a public health official per se. I'm a medical doctor. But what I would say, I feel like the stakes are extraordinarily high for us with this infection. I feel that, if you look at models online, if we hadn't done the social distancing that we had done, I saw one model that showed within a period of, say, 30 days, you would have had 10 times as many infections. So I think all the things that have been done here in our communities in the state of Massachusetts and other parts of the country, I think, have really translated into saving, in the state of Massachusetts, we've probably saved thousands of lives already by our social distancing practices over the last couple of months, maybe even tens of thousands of lives. And we're going to be facing this challenge for the foreseeable future. I know Dr. Fauci likes to say, let the science guide us, let the numbers guide us. And so I would say, I still feel that, hopefully our government leaders will, listen carefully to the scientists. I feel that in the state of Massachusetts, I really give Governor Baker, very high marks for how he's managing everything. I think he's being cautious and appropriately prudent and using expert opinion from the healthcare field to help guide his decisions. And hopefully this will also take place on the national stage as well.
Thank you, Dr. Phillip Triffletti. He is an attending care physician at Beth Israel Deaconess. We're going to go to our state representative, Matthew Muratore. Matt, Dr. Triffletti talked about Governor Baker. Do you agree with the manner in which he's been handling things in the Commonwealth?
Yeah, absolutely. And I am a public official. I am a healthcare consultant for over 30 years as well. So I need you need to, in something like this, you need to have the data drive the outcomes and the next steps, not the dates. And I think we all need to kind of keep that in mind.
Thank you. One other question from Senator Muratori. Any idea when we'll be able to return cans and bottles?
No, not at this point. But what I would personally recommend, which is what I was doing, we have recycling that comes every 2 weeks, and we put them all in the recycling. I don't know if I would really want to hold. I know a lot of people are holding their cans, in the garages or sheds, and they're going to wait to bring massive amount of bags in. I don't know if that's going to be a smart idea. I think you just eat the 5 cents per bottle and can at this point and put in the recycling and let the trash folks take it away.
And thank you. Each day we go back to our panel. They've had a chance to hear each other, and now we're going to ask them to give their closing statements. We're going to begin with Dr. Christopher Campbell, Assistant Superintendent. Chris, what would be a takeaway today for our viewers?
Thanks, Steve. I just want them to know that, our reentry plan is going to take some time, but with the collective goodwill of our entire school community and the community at large, I have no doubt that we'll develop a very safe and thorough reentry plan when the time comes for the fall. And to our families, as always, please reach out to your child's teacher, to your child's principal, or any of us at central office at any time if you have any questions, any concerns, if you need anything. Again, safety and security is our #1 priority, and we'll be communicating regularly, seeking the input of our families along the way, and hope to have a really thorough and safe reentry plan for the fall that we'll be communicating in the near future. So, and always, at any time, please reach out to me for any questions, concerns, or suggestions that you may have. And just thank you for having me on today, Steve.
Thank you, Dr. Christopher Campbell, Assistant Superintendent, Plymouth Public Schools. On Monday, we'll be joined by the Superintendent, Dr. Gary Maestas, and he'll be giving us an update as to some important events coming up in the near future. At this time, we're going to go back to Muriel Paul. Muriel, what would you like us to remember from your presentation today?
I guess I would just like to say thank you so much for having me on today. As a reminder, there are so many amazing organizations and social service agencies who have had to shift what giving services looks like in these times. But remember that everyone is still here, whether it's working from home. People are doing their best to meet people where they're at and get them what they need. As far as the Healing Communities study, we are still with this goal to reduce opioid overdose deaths by 40%, really as soon as we can. Our goal is to keep people safe, keep people alive, and get them the help and the treatment that they need. One of the pieces of this study too is that it's a harm reduction focused grant, meaning that any harms that are associated with opioid use, we want to help to reduce those harms and help people and really meet them where they're at. So if you need help, if you're somebody who's passionate about addressing opioid addiction, or some of those things that I talked about earlier in regards to increasing access to Narcan, in regards to increasing access to medications for opioid use disorder, and talking more about safe prescribing guidelines and making sure that we're treating people with dignity, respect, and getting them the medical care that they need, reach out to me. You can get in touch with me, I guess, by contacting Rep Muratore, who can put you in touch with me. But thanks so much for having me on today.
Thank you. And that's Muriel Paul, and she's with the Community Engagement Facilitator Healing Community Study. At this time, we're going to go to Stephen Cole, and he's the Executive Director, Plymouth Regional Economic Development Foundation. Steve, what should we remember?
Well, I guess based on the polls, based on the stats, and kind of building off of some of the themes we've heard from the chairman and the state rep, take care of each other, and yourself. Our recovery is going to depend on our preparedness, and that means more than just wearing a mask and following social distancing guidelines. That means being and staying healthy. Check in on one another and challenge yourself in new ways. And I include writing a business plan because, look, we're going to need someone to fill those vacancies. We're going to need to get people back to work. I said on one of the previous broadcasts, right now we're really relying on our healthcare heroes. At some point, we will have to rely on some of our economic heroes who will get us back to work. And so for those businesses that rely on tourists, our guests will emulate our behavior. So we need to set a positive tone and manage the expectations for our guests. Thank you, Steve.
Stephen Cole, thank you. And now we're going to go to Dr. Phillip Triffletti. Phil, what would you like for a takeaway today?
Thanks again, Steve. So, I loved hearing some of the polls and statistics that Steve Cole brought forward. And you can see there's a lot of reluctance in consumer behaviors about, as we have some social reopening, how eager are people to get out there? One of the things, in the midst of this pandemic, I think some people are counting the days until things will return to normal. And I have a friend, a therapist who I admire greatly, and she shared this quote with me. And basically it said, instead of just counting the days, make sure that you make every day count. So I'll leave you with that for today.
Thank you, Dr. Phillip Triffletti. He is an attending physician at Beth Israel Deaconess. And at this time, we're going to go to Julie Thompson. She's the Executive Director for PACTV. Julie.
Takeaways. Wow. Every day I'm so fortunate, Steve, because I watch your whole show. Obviously, I'm there with you. I also am lucky enough to be able to host a lot of forums for our other towns. And what I hear, what I see is people care. People genuinely care. There's so many people out there willing to help other people. But get your information from people that you trust. That's one thing that's really come through on this. I'd like to make sure you tune into PACTV. Local community media matters because we have your local officials, we have local businesses, we have local organizations. Local is really everything right now because it's right here that we're going to start to live our lives again. So please do visit pactv.org. Be kind, be patient. Thank you.
Thank you. That is Julie Thompson, Executive Director for PACTV. Yesterday, we had a special guest, Dr. Christopher Ogilvie, who is a brain surgeon at Beth Israel Deaconess in Boston. And after participating in the presentation, he said he was so impressed with the contributors' information and the positive nature of how the town is dealing with this situation. The forum is really fantastic. So credit to PACTV, credit to all the people who have been participating in this forum for the past 45 shows. Matt, what do you have for today?
That's great to hear, Steve. Nice to hear those comments. And, there is a reason why we do these, and Julie's right. It's we care, and we want to make sure people are getting the factual information, the factual data. And it's only best to get it local than particularly nationally. And I always tell people, watch this show daily and also watch the governor. And that's really what you need to know, and we really need to understand. I love Dr. Triffletti's, last comments, make every day count. I always talk about on these shows, some silver linings. And I think for all of us, as much as family may drive us crazy sometimes, but I think the whole silver lining and making every day count is spending time with your family at home. If you're lucky enough to, to have children like I do, and you really, after a while, it was, you realize, this is really a gift that we're being given by spending more and more time with our own family and people that we do care and love about. If you look at it that way for now, because eventually at some point, maybe not in the near future, but in the long run, that we're going to be back to the rat race where we're going to be out there and, working all these hours and at all these meetings, and we're not going to be around as enough. So treasure these moments that you have at home at this point. And again, the final message, obviously, every day is, stay home. You're saving lives by staying home. So continue to do that. Continue to follow the orders. We will hear more about the opening of the economy on Monday, but please don't expect much more than what's happening right now. There's just going to be stricter guidelines, but we're not going to see a mad rush to restaurants or anything like that on Monday. It's going to take some time. These are going to be done in phases, but so continue to stay home as much as you can. Stay calm and stay informed. Stay informed by going to mass.gov/COVID-19, or you can call by calling 211 if you have questions. Get text alerts, which is the best way to find out what's happening. Text COVID-MA to 888-777, or in Spanish, COVID-MA ESP to 888-777. If you have questions on your health, it's bowie.com/mass if you have questions on your health. And again, thanks to all those essential employees who are taking care of our physical health, and of course, all those essential employees who are taking care of our economic health. And to you, Steve, for doing all these shows and coordinating this for us, and for Julie and the folks at PACTV, thank you again for all you're doing for our community.
Thank you to Plymouth Representative Matthew Muratore. We've been joined today by Dr. Phillip Triffletti, Dr. Christopher Campbell, Muriel Paul, also Julie Thompson, Stephen Cole, and we're going to go back to the chair of the Plymouth Board of Selectmen, Ken Tavares.
Thank you, Steve. I have just a few words to end this day with, and that is stay the course, wear a mask, follow the rules, and in the words of Dr. Triffletti, because the stakes are high. Thank you.
Thank you. That's Kenneth Tavares, and he is chair of the Plymouth Board of Selectmen. Please join us tomorrow when Ken, Matt, and I will be joined by Dr. Barry Potvin. He is a professor emeritus from the Department of Biology at Yeshiva University. Once again, we'll also be joined by Jack Cochio. He's the Chief Executive Officer for South Shore Community Action Council. Lawrence Pizer, Plymouth Town Clerk, will be updating us on Tuesday's special election. Robert Eisenstein is a senior living consultant, and Plymouth County Sheriff Joseph McDonald. They'll all be here tomorrow at noon. Thank you for joining us. I'm Steve Triffletti, Plymouth Town Moderator. Good day.